Welcome to the Miscarriage Hope Desk Podcast, where we help women struggling with recurrent pregnancy loss by sharing stories of hope and interviews with experts in the field of fertility and miscarriage. If you want to download our free lab checklist, go to miscarriagehopedesk.com/labs. Again, you will go to miscarriagehopedesk.com/LABS to download your free checklist. If you want to connect with others going through recurrent miscarriage, please check out our show notes for a link to our Facebook group. Now I'm going to hand it over to your host, Laura Bowder, for today's episode.
Welcome back to the Miscarriage Hope Desk Podcast. Today, our guest is Zeina Alkhalaf, and she is going to be sharing a little bit about her personal experience with miscarriage, as well as some of her expertise as a researcher and PhD student in maternal and child health. So Zeina, thank you so much for being here today.
Thank you for having me.
So what I think I want to start with is giving you a chance to tell us a little bit about your personal story and how that kind of then fits into the work that you do with maternal and child health.
Sure. So I actually got into that world because when I was 23 years old, I was newly married. I had just gotten off the pill and I realized that I wasn't getting my cycles. And so after a couple of months of struggling with the hormonal shift and all the issues that I was having with my cycle, I went to see a doctor and I was diagnosed with PCOS.
Okay.
I found very little support. I found very little information online, mainly for my type of PCOS because it was lean PCOS. And so a lot of the medications that were given weren't working for me. They were not regulating my cycle. I was given metformin, Clomid, a whole bunch of medications. And so we ended up having to resort to IVF, and we used that to have my first daughter. Mm-hmm. And then from that, I actually started my research. I wanted to learn more about why, did I get PCOS? How did that start? What were some of the exposures that I was exposed to that could have increased the risk of having that? And I found that it was really shocking that one of the first things that I actually read was that BPA raises your risk of having PCOS. And so I said, okay, why aren't we knowing about this? Why isn't this talked about? Women that are having PCOS, they go to the doctor, they just tell them take metformin, take Clomid, and we don't know that there are other sources that are increasing that risk. And so I decided to get my master's in public health. I wanted to learn more. I wanted to have that background and knowledge in public health and in maternal and child health. While I was doing my MPH, I actually fell in love with research. And my husband originally is from Kuwait. And I knew that coming back here, there isn't a lot of research that's being done in maternal and child health within the country, as well as to add to the knowledge that is known around the world. Mm-hmm. And so I decided that this was the path that I wanted to take. And so I pursued my degree in PhD. My story of loss is actually when I was in the middle of my MPH, completing my MPH, we decided to grow our family, and I had an embryo transferred to me. I had ended up having a subchorionic hematoma, which usually resolves on its own, and within the first trimester it goes away.
Yeah.
But mine unfortunately continued to grow and get bigger, and I ended up losing a lot of blood. My story is pretty similar to Chrissy Teigen's, and it really resurfaced a lot of the trauma that I had watching what she was going through because she didn't come out. Yeah, she didn't come out and say I had a subchorionic hematoma in the beginning, but from what was happening to her and the blood clots and the bed rest and all of that, it was very similar to what was happening to me and having to have blood transfusions. I actually was hospitalized for over 2.5 months, and I had 11 bags of blood transferred to me. Yeah. And I ended up losing my son around 22.5 weeks. So we were trying to get to the 24-week mark, just like Chrissy Teigen was. I totally felt her story so much.
Yeah.
But it was not in the cards. And afterwards, I really went through a lot of grief, but also a lot of gratitude for being alive, because I knew that I was on the brink of being a part of the maternal mortality rate,
Yeah.
I also lost my life. And so this is my story of studying maternal and child health, but simultaneously having a personal story tied to the research work and my passion of working on maternal and child health.
Oh my goodness, there's so much to unpack there. And I want to thank you for sharing that with us. And I'm sure that there are listeners who can relate to your story. I want to back up a little bit and talk for a couple minutes about, first of all, what the experience was like for you moving from trying to start a family, realizing that you had PCOS, and then the IVF process. Like, what was that like for you? How were you able to process that part of the journey to motherhood?
Oh, I think infertility on its own is a tremendous grieving process.
Absolutely.
I felt as if my body was failing me. I felt as if I had failed as a woman. I mean, really, to be 23 years old, sitting in an IVF clinic, I felt like, what is wrong with me? Why can I not do the simple task of getting pregnant? I went through a lot of mourning for that. It actually was extremely difficult on my mental health. And I felt like it really took a huge toll on me, you know?
Yeah.
It took a lot to accept the fact that I had to do IVF. And I remember in the beginning when I got diagnosed with PCOS, I was actually in Kuwait and I went back to the US. I traveled back to see my gynecologist and she told me, don't come to my office until you've tried for 1 whole year trying to get pregnant. I told her, what's the point of telling me leave for a whole year if I'm not even ovulating? Right. You know, and that on its own. So then she was like, we have to do a biopsy, and the biopsy proved exactly what I was saying, that I actually was not ovulating. And that on its own, not being heard by my doctor and not being, I think really the word is heard and felt for who I am as an individual, saying, hey, I'm trying to get pregnant and I'm not even getting my period.
Yeah.
Like something is wrong, help me. And so it took me a while to even find the support that I needed to go to do IVF to get pregnant. And I was told my type of PCOS was actually really extreme because when I would try any of the medications, Clomid would not even let me ovulate. But when I tried like the Alkhalaf and the other shots that you would take to help induce ovulation, I would hyperovulate and it would be like 20 eggs growing at the same time. And we did this for about a year. It was a lot of back and forth, a lot of pain. It was they were very painful procedures. I got a huge cyst when I was doing one of those procedures that was bleeding in the middle of my uterus. And so it was very hard. And I think, again, I think infertility on its own is a tremendous grieving process. And a lot of women go through it and we go through it silently. And that's why I feel like it's really important to open up and talk more about our experiences, because there are a lot more women that are suffering through infertility that is actually known or that is being talked about enough.
Absolutely. And, making it through that difficult experience of just kind of processing all of those feelings, you went on to have your first child. And then what was the shift, or what kind of defined your decision to, like, okay, we have one child, we've gone through IVF to do that. What was the decision like to try again?
Yeah, we actually had gone back and forth because I had regulated my cycle a little bit. I actually started my own blog at that point because I had realized cutting out certain chemicals. I cut out as many chemicals as I could from my house. I started going organic. A lot of those things actually started regulating my cycle. But around the time of my schooling, my husband was also in school. And so we had a lot of stress on us, and stress also can reverse your PCOS and have you to have the symptoms again. And so at that point, when we decided it's the right time to begin expanding our family more, my cycles were off because of the stress that I was under with going to school and my husband going to school. And so we had gone a lot back and forth. My husband wanted to try natural. I didn't want to go the route. I said, we have the embryos. They're healthy. We had done testing on them. I just want to go ahead with the process and, do a transfer. And so that was kind of when we decided, okay, let's just go with it. And, that was the route that we had chosen to expand our family at that point.
Yeah. Well, I think it's, you go through so much in grieving, like you mentioned, then to kind of be faced with, okay, do I want to go through all of that again? Or, like you said, you had those embryos that were ready. So I think that makes sense. But I think that definitely, like, that's a decision that I think is really hard.
Yeah, I was also scared of disappointment. I had been disappointed so many times. I had never seen a positive pregnancy test when we were trying naturally, that I was also afraid of wasting our time. This was based on our timeline of schooling and what we wanted to do to continue. This was the perfect time for us. Mm-hmm. And so I was afraid, again, of the disappointment, of the shame. I would feel the guilt I would feel on my own of not being able to get pregnant naturally, as well as messing up the timeline that we had in our perspective of what we wanted to do for our futures and our mm-hmm. career.
Yeah, it can be so frustrating to feel like you don't have control over this particular aspect of your life.
Absolutely.
And then as far as the loss that you experienced that you were telling us about, first of all, I'm very sorry for your loss, and I appreciate you sharing, because like I said, there's so many people that are going to be able to relate to this story. Looking back on it now, I guess, what were some things that you found to be really helpful and healing to you? And were there anything that, let me rephrase that. What were some things that you found to be really helpful and healing through that process? And is there anything that you would change or that you wish that somebody else would have done differently during that process?
That's a really good question. And I think it's so personal, right? Because it's like when you go through a loss, the experiences you go through is so different than someone else, maybe even experiencing the same exact loss. I remember when I was pregnant and I was hospitalized for so long, there were a lot of moments where I almost lost my son. And I kept trying to hold on to hope. I felt at that point, hope, so beautiful with the name of your podcast as well. But I felt like hope was the only thing that I could hold on to keep going through what I was going through. I held on to hope. I held on to hope, excuse me, that he would survive it and he would make it through.
Yeah.
When I ended up losing him, I felt like it was such a shock to me. Sure. And I was trying to process all the things that happened at the same time. The way that the loss happened, I'll talk a little bit about it, but I feel like it might be a little bit shocking to some people. But I actually was here in Kuwait when I ended up having the loss. I was originally in a private hospital, and when I started losing a whole ton of blood, they told me, this doesn't look good. We might have to terminate and to save your life, and we cannot do it here. We have to send you to a public government hospital to do that. Here in the country, to terminate, you have to be in a government hospital, has to be approved by a whole bunch of doctors. And so they sent me there, and I was bleeding, and they told me, this is not good for you. Like, we have to help you survive this. And so they said, if it gets to a point where your life is really now not even in question anymore, we're going to terminate the pregnancy. And I said, that's fine, because I was not okay with terminating it before. I kept telling them, I'm not terminating. Let's keep trying to get to 24 weeks. Like, my goal is to help my son survive this pregnancy.
Yeah.
And so I think things got pretty rough, and they ended up telling me they were doing an amniotic swab to check if I was actually leaking amniotic fluid, but they ended up doing a membrane sweep to help me deliver him, and and all of that. And I had no idea, but the intense pain of that membrane sweep on its own traumatized me, and I left the hospital. I said, I'm done. Like, they did something, I don't know what they did, but I'm in pain, and my contractions started right after, and I actually ended up delivering him at the private hospital. And so a lot of my grieving had to also do with the way that I lost him and the steps that happened to lose him. I was not very aware of them trying to terminate the pregnancy. And so I think that on its own took me a while to kind of put pieces together and understand what happened.
Yeah.
But in retrospect, when I look back now, I realize I would have never given the approval to terminate the pregnancy. And I would have probably lost my life. So I know in retrospect, they did this for me. But after I lost him, I did let myself grieve. I gave myself a couple of months. I cried. I traveled. I spent a lot of time with my daughter. That on its own was really hard to tell her, that we had lost.
Sure.
Yeah, and I think a lot of parents struggle with that because you don't know how to tell your child that is old enough and aware enough of your pregnancy and that there's a new sibling on the way, that all of a sudden they are gone.
Right.
And so as soon as I lost him, I had remembered a blogger on Instagram that had lost her child 3 years before my loss. That loss post that she put never left my mind. I remember being in the hospital the day after I lost him. I'm scrolling down her Instagram 3 years back just to see that one post.
Yeah.
Because I needed to hear someone else that went through a loss, a late-term loss, and survived it. And I needed to know like how she got through it. And so I think hearing stories of other parents that had gone through a similar loss, sorry, it gets emotional just remembering that time. But I think hearing similar stories really does give you comfort in knowing that there are other people that have gone through similar difficulties and have survived it. And I think that's, again, a part of the reason why I really wanted to share my story too, because I know there are other people that are still looking for stories that are similar to theirs, basically survival guides of how to get through, a loss like that, or infertility, or multiple miscarriages after each other.
Yes, for sure. And, we believe that so strongly here too, that first of all, sharing your story is healing for you, and hearing other people's stories are so helpful. And yeah, just, you never really know how much impact you're going to have, like that Instagram post from 3 years ago. People remember that kind of stuff, and to have it out there in the world means that people are going to find it when they need it.
Absolutely. And it's hard. It's hard to be vulnerable. I was so amazed at the strength that it took for that blogger to post her story, and for Chrissy Teigen to post her story. Because I remember at that time, you're crumbling. Like, you are not in the sense capable of even expressing this grief. And I don't know why, but it would make me angry every time someone would send me like a message. I felt like someone was feeling sorry for me, and I don't want anyone to feel sorry for me. I felt like it was disempowering me as an individual and as a woman. And so I think a part of me also stayed away from posting stuff about it, especially after my loss, because it was really hard for me to process my own grief with messages from other people feeling sorry or sympathy during that time. And so I really commend them for sharing it, because I know how difficult it is. It's really, really, really hard to put yourself out there during such a vulnerable period when you're still trying to process what even happened to you.
Yeah. I think too, everybody processes it so differently, but I know, I'm just thinking back to, I experienced a loss much earlier in pregnancy, but I didn't want to tell anybody about it. I didn't want anyone to talk to me about it, because the way that I processed it, which is not always the best way, was to try and distract myself, right? And think about something else, bury myself in work, or do something like even read a book or watch a TV show just to distract myself. So to be kind of called back into that place is not always what you're looking for when you're trying to heal.
Absolutely. And I feel like a lot of, after I had the loss, I was grabbing strength from everything I could. I had no strength in me, but everything I was listening to, I was very aware of the podcasts I was listening to, the shows I was watching, the books I was reading, the songs I was listening to. Everything that I surrounded, the energy I surrounded myself with, I made sure on every degree that it gave me strength, that it was positive energy. And maybe that's why when I would get sympathy messages or feeling like someone feels sorry for me, it would drain that strength that I was trying so desperately to grasp and to hold on to, because I knew I either could crumble and let this destroy me, or I could feel, but then pick myself up and say, I will get through it. Like I have only two options at this point.
Yeah. Yeah, that's such a good point. I would love to transition just a little bit because I know you have such expertise in this area as well. And I wondered if there was anything that you wanted to highlight for us as far as research findings, whether it has to do with fertility or miscarriage specifically.
Yeah, one of the biggest things that shocked me a lot was that a lot of exposures that we are exposed to actually increase our risk for infertility or for miscarriages. Of course, there's a plethora of different reasons why this could happen. It could be either hormonal shifts, or it could be certain exposures. It could be many different things. But I think it's really important to understand, especially in the research, that there are exposures that can increase your risk. And living a cleaner lifestyle is really important, because the thing is, we don't know what is the threshold of how many chemicals, for example. And I will give, for example, one of the chemicals is like household cleaning products, right? Every time you're using them, all of them have different types of chemicals in them. Or makeup, for example, makeup on its own also has a whole bunch of chemicals in them that are not very well regulated. I mean, the EU has over 1,000 chemicals that are regulated in makeup, where I can count on my hands, my two hands, how many chemicals we have regulated for makeup. So there are a lot of, dangerous chemicals that can shift our hormones, that can increase your risk for miscarriage or for infertility. But we're not as aware of them. And so I think, when I started creating my blog too, I really wanted to share with moms and with women that were trying to become pregnant, easy, simple ways to kind of, cut chemicals out of your life to try to reduce the exposures that you're having. Different people are sensitive to different levels of chemicals. And I also realized through research, women with PCOS also are sensitive. They're sensitive to exposures, whether it's in your cooking pots and pans, whether it's in pesticides, whether from chemicals from your household products, or laundry detergent or makeup. And so I live a life of not complete, like cutting everything out, but limiting as much as you can, right? Like every month you can cut one thing out, you can change one of your products at your house to try to kind of limit that. I have personally seen a huge change in my own hormonal cycles, and I actually became pregnant naturally after my loss. Yeah, about 9 months after, when I didn't think it would be possible, but it happened. And so again, I really think it's important for us to know that whether you're even trying to become pregnant or not, just cutting these chemicals are really important for our own hormonal levels, and to make sure that things are more regular in our cycles.
Yeah, it's interesting to think about, but also like you go down that rabbit hole and it gets a little like, oh no, like all of the things in my house and all of the things that I use. But I think you're exactly right. It's not very well regulated, especially depending on where we live. And we don't even think about it. These are things that have been around us our whole lives at this point. It hasn't been something that's been like introduced into our world, really. We've always been around household cleaners and seen women wearing makeup and probably eaten certain kinds of food. So we don't really look at that with a critical eye. So I think that that's something to consider for sure.
Absolutely. But I'm so aware of the anxiety that can happen from realizing it's literally everything, because I had that, and I was like, what is happening? It's everywhere. It's in everything. And it's taken me years to kind of start cutting things out, and I'm still doing that, and then so I think it's really important to shift the perspective from it's everywhere to, okay, what can I do this month? Or what are some of the things that I want to switch out once they finish in my house? to safer products, and the beautiful thing about it is a lot of the things that are good and safe for you and your family are actually really good for the environment as well. And so you're doing a double whammy when you're changing out these products. You're actually also helping the environment. And I share a lot of these things kind of on my blog online and things like that, to make things easier. And it also helps you save money when you start switching out these products. Like for example, I use this. I don't know if I'm allowed to share brands, but I use a brand, Alafia. They have soap, and it's just natural shea butter, coconut oil. They use all these natural, ingredients in them. I use it as for my hands, to wash my hands, as body wash, and to remove my makeup. And so I completely cut out getting makeup removing wipes that are not only really horrible for the environment, they have a whole bunch of chemicals that are unnecessary. That soap does wonders, and it just removes all the makeup off beautifully. And again, it's good for the environment, and it's good for me, and it saves me money.
That sounds awesome. Do you have let us know where we can find your blog and your resources, and are there anything you would suggest as far as like some pretty attainable first steps if people are looking around their house and wondering what might be something that's relatively easy to swap out?
Yeah, absolutely. I think switching out your soaps, for example, having them be multi-purpose, like I said, that brand of soap that I had mentioned, it's really, really wonderful. Another really great thing to buy is like Dr. Bronner's has like a Castile soap that you can buy that's pretty inexpensive, and it's very, very concentrated. And so if you dilute it into, I buy these glass bottles that are reusable from Amazon, you can buy them anywhere. Just fill it up, and with a whole bunch of water, you have a multi-purpose cleaner everywhere. You can clean your counters, your floors, your drawers, bathroom, everything with it. I really don't see it as necessary to have so many different cleaning products. And it's safe and it's healthy. One of the other things that I do is, for example, for my herbs and spices, I buy organic, because I say, herbs and spices are really good for you. They're very healthy. They're flavorful. So why not make sure there's no pesticides or chemicals that are coming along in your food as well. So I just buy those organic. And so, these little simple swaps that you can do every day are better and safer for you. Your Tupperware, just buy glass, it's better for you and for the environment as well. And they last a lot longer, the glass Tupperware versus the plastic. And so, those are a few things. My blog is called Confessions of an Organic Mama. And on Instagram, I actually started putting more videos, and I think it's really nice to be more interactive, have really short videos that kind of share information. And I share research information as well as my own personal experience and products and stuff that I use.
Great. Yeah, I think instead of getting overwhelmed with all of the many things that we could change, I think that's a good kind of overview of some things that are relatively easy changes to make. But as you mentioned, they can make a really big difference. And would you attribute some of those changes to you being able to then get pregnant naturally?
Absolutely. After I had the loss, we decided that we weren't going to go the IVF route anymore. Some of the doctors said it could have been just because of infertility treatments. And so we decided, let's try. And I really worked hard on making sure I'm cutting out as many chemicals as possible. And I used a few herbs that help you also regulate your cycles with PCOS. And yeah, I became pregnant naturally. And I definitely do believe that all of these exposures, cutting them out and helping myself living a more cleaner lifestyle really did help me become pregnant again naturally.
Yeah. Well, that's great. And I know I want to be respectful of your time, but one of the last things that I know we wanted to touch on in this conversation is some of the research that you mentioned about disparities as far as any what am I looking at here? Disparities between racial and ethnic groups when it comes to miscarriage and fertility issues.
Absolutely. I think one of the most difficult things for me with my research and with going through my PhD is learning so much about the disparities that are happening. between Black and white women in regards to miscarriage and loss or prematurity with their children.
Mm-hmm.
And there's a really huge difference. And I think it's really important to understand that suffering and going through a lot of stress really does increase your risk of miscarriage and of having an early delivery, so having a premature child. And so a lot of these disparities in the way that Black mothers are treated or Black women are treated, I think racially, especially within the United States and maybe around the world, but the highest disparities are seen in the United States. And I think it's a conversation that has to be opened. We have to have these conversations. It goes well beyond the BLM movement. I think when it happened, it really touched home because we have literally biologically measured the stress that comes from having racial aggression towards Black women and mothers, and how that those experiences impact their ability to become pregnant or maintain their pregnancies or to have a premature child. And so thank you for allowing me to have this conversation and kind of open it up, because I think it's really important to understand that this is real and these are conversations that have to be had. We have to know what's happening. What can we do beyond that? How can we be more aware of how we treat each other and how we respect each other, and how this may impact someone's ability to either become pregnant or maintain their pregnancy or have a child that is premature.
Mm-hmm. So in your research, are there any specific factors, like we mentioned, stress? Is there anything else as far as, is this something that's related to response as far as like medical care? I know there are all kinds of implications as far as the way we do medical insurance in the US.
Absolutely. It is due to multiple factors. One of them is to be racially segregated, to have racially segregated areas. A lot of these areas that are segregated don't have as much access to healthcare. And so when you don't have access to be able to go to a doctor while you're pregnant or when you're going to deliver, it really lowers your, I guess, your ability to have a safer pregnancy or delivery. One of the other factors with that is the way that our healthcare actually does treat Black mothers. Unfortunately, Black mothers are 4 times more likely to die during childbirth. And that is because a lot of times through the research, we found out a lot of the times when they mention that there is pain, their pain is either ignored or responded to too late. And so usually there is internal bleeding that is happening. There is an issue that is happening. And it's not responded to in time. 2 of the biggest celebrities that actually almost died during childbirth is Serena Williams and Beyonce. They both suffered. Serena Williams had a blood clot disorder that she actually let the doctors know ahead of time with, but she almost died after giving birth to her daughter. Even with how much money she has, the resources she has, you know, the fact that she's a Black woman put her at a much higher risk of dying than any other white woman. Beyonce had preeclampsia with her twins, and she also almost died with that. These are both really life-threatening situations that may happen to any woman, and they came forward and they talked about their experiences. And I think highlighting the importance of these stories and the fact that it's actually happening a lot more than it should is really heartbreaking. I was reading a story about a Black mother that actually was a doctor. She's a gynecologist, and she died giving birth as well. These things do happen, but they are very preventable. This is the problem, is, you know, when we're researching maternal and child health and learning about it, the fact that these are actually really preventable deaths is what makes it astonishingly unacceptable. The fact that it's even happening, and in all the first world countries, the United States has the worst maternal mortality rate in the world. And that is actually really, really heartbreaking, knowing how much resources we have and the latest technologies that we have, yet Black mothers are dying at 4 times the rate of any other white woman. And this has to change.
I completely agree. Is part of it too, I mean, so if we're thinking about the pregnancy loss aspect of this, is that a similar thing as far as if they're having complaints about something, it's responded to later? Is it that they're just maybe not getting as regular access to healthcare, so they're not being checked up on quite as much? Is there anything that's going on there that might contribute to a pregnancy loss?
Yes, it's a compilation of a whole bunch of risks. One of the latest research findings that we've been finding is there's something called allostatic load, which means when you have had such a tremendous amount of stress, which increases your cortisol levels so high, and it's a continuous stress that you're constantly dealing with. And we know that this happens specific to race, and Black women face this a lot more than white women, right? This gives you a much higher allostatic load, and that allostatic load increases your risk of having miscarriage or pregnancy loss or having a premature child. And it's really important to understand that this has been biologically measured. And so these experiences that they are having that are potentially even go through generations genetically, we are now finding out that potentially your genetics could change based on your different exposures. So if you're constantly having these racial experiences and they are impacting your genetics, you could actually pass on that DNA and that stress to your generations after that. And so it really does have a huge toll on their overall health and well-being.
Definitely. So when I hear that, I hear two things, right? And one, of course, is in the control of the healthcare system and how they're reacting. But the other thing that comes to mind is something that we have talked about many times on this podcast for a lot of different reasons, but just the importance of empowering women and making sure that as a woman, you're advocating for yourself.
Absolutely. Absolutely. Alongside the conversation of the maternal mortality rate in the US, I think it's really important to advocate for yourself. Personally, I learned that. I learned that I had to advocate for myself, even being a white woman that might have some privilege. I was still not heard. I was still not seen when I needed to. And so it's really important to stand up for yourself and stand up for yourself when you feel something is wrong. And so this definitely transcends into this conversation. Women of all colors, but specifically Black women, have to advocate for themselves. I definitely believe sometimes hiring a doula or a midwife to support you at the hospital may also help increase your ability to advocate for yourself, especially if you are unaware of some of the risks or you're worried that you may not be able to have a voice or the voice that you would like. Hiring a doula or a midwife could really support you. But I think even if you're unable to do that, going to your regular prenatal checkups as much as you can, seeing your doctor, trying to eat healthy, surround yourself with as much positive energy as you can, staying away from stress. I know it's sometimes very, very difficult to do that. But all these little small changes that we could do can really support you in your pregnancy and hopefully to have a healthy pregnancy and delivery. And again, always, have a relationship with your doctor. If you feel like something is wrong, definitely speak up and do not wait. And if someone is not listening to you at the hospital, you go to somebody else and let them know something is really wrong. And so hopefully you will have that support system around you in case something does happen. Someone can react to it in time.
Yeah, it's kind of a like, don't be satisfied with someone pushing you off, or don't settle for an answer that isn't satisfactory to you. If you feel like something is still not right, then you need to find somebody who is willing to look into it.
Absolutely. And I think that goes all beyond whether it's prior to becoming pregnant or going through infertility or while you're pregnant or even after pregnancy. I think just advocating for yourself, even if you feel something is really wrong when they tell you nothing is, I think it's really important for us to learn to have a voice. It's sometimes really hard to in the medical field. I mean, I still feel kind of uncomfortable saying something, but I've learned to have a thicker skin and really stand up for myself when I do feel something is wrong, because I know we can be more in tune with ourselves than someone else can just listening to you for 10, 15 minutes,
Yeah, definitely. Zeina, thank you so much for sharing your story, your expertise with us. I really appreciate it.
Thank you so much for having me, and it was wonderful meeting you, and I appreciate allowing me to share my story and hopefully reaches other women.
Absolutely. Remind us where the listeners can connect with you online.
Yes, my blog is called Confessions of an Organic Mama, and you can find me either on my website or on Instagram. I'm also there. I'm also on Facebook, but I am most active right now on Instagram, and so you can always find me there.
Great. And all of those will be linked in our show notes. And Zeina, thanks again.
Thank you so much, Laura.
Thank you for joining us today, and don't forget to check out our show notes for details on joining our Facebook group and for following along on Instagram. If you would like a free recurrent pregnancy loss lab checklist, go to miscarriagehopedesk.com/labs. Again, that's miscarriagehopedesk.com/LABS to get your free downloadable checklist. And for even more resources, visit the Miscarriage Hope Desk website, where we have stories of hope plus an entire library of evidence-based research articles related to fertility and miscarriage. If you enjoyed this episode, I would so appreciate it if you rate, reviewed, and subscribed to the Miscarriage Hope Desk podcast. Your ratings and reviews will help others to find us. I want to wrap up by saying that if you are going through a miscarriage, my heart goes out to you, and as difficult as your experience may be, I want you to know that you are not alone and that you will find a path forward.